Dana Miller presents the 9th Annual Obesity Conference, a practical look at obesity, diabetes, and current strategies, featuring Jane Sarasohn-Kahn, M.A., MHSA, Consumers Going Mobile and Digital for Health.
Now on something else is something that our patients are, I've learned from my patients initially, and then we're entering the world of digital, and I think it's really important to appeal. Our traditional ways of providing care need to change, and so we're learning from our patients, and we can help our patients with this as well. So our next speaker is Jane, is it Sarasohn?
Sarasohn, good.
Okay, all right, okay, wonderful. Jane's a health economist, advisor, and friend weaver supporting organizations at the intersection of health technology and people. That just sounds awesome. Jane advises on strategy versus via environmental analysis, scenario, and strategic planning. She founded the Think Health after working for 10 years with healthcare consultancies in the US and Europe. And then Jane's clients are stakeholders in health technology, bio-life sciences, providers, plans, retail, financial services, food, and consumer goods. She founded the Health Populi blog in 2007, celebrating a decade and over 2,000 blog posts, amazing, in April 2018, all written by her. Please welcome Jane Sarasohn-Kahn.
Thank you. Thank you. Well, I learned a lot from you this morning, especially when I saw the Kool-Aid slide, and I thought I must have had an adverse childhood event with Kool-Aid, because I look at it now and I just have that Pavlov response of don't touch the button kind of thing. No, it was a bad Kool-Aid event. I don't know what it was, but I learned a lot clinically and a lot about myself. So thank you. I love that. Anyway, hi. This is a different flavor. We're moving from sort of the rat model to the consumer model right now. All I think about is these days is patients, consumers, caregivers. As a health economist, how do we take this broken, unsustainable economic model of healthcare and get patients more engaged in health so we can move the needle on costs, quality, and outcomes, that triple aim that we talk about. And lately also we talk about the quadruple aim, which is how do we also prevent burnout in clinicians and nurses. And if we put more work on the patients with shared decision making and more health literacy and sort of kumbaya together, I think we can help solve the quadruple aim issue as well. So that's a quick introduction to me here. I'm so delighted to share these perspectives with you at a meeting like this. So thank you. I'm also in my town. I was in Europe for three weeks in early October, and in Las Vegas on Monday and Tuesday at the grocery shop conference looking at food and health. So I'm so happy I could drive to see you today. Thank you. Seriously. Anyway, this is what I want to talk about today. First, looking at this patient and her and his many hats that people wear now, and how does that impact people's approach to their own personal health economy and how they use technology, because everybody's using technology, and we'll talk about the morphing of that human into something we call Homo informaticus. And I've got a drawing that will make you laugh and then make you think, I hope. And then I'm going to talk about this proliferation of technology and digital health technologies, and then technologies devoted to weight, obesity, and diabetes. And how can we leverage these with our clients, patients, to do better? And then I want to shift a little bit and talk about a concept I've been speaking about a lot in the last couple of years and writing about, and that's the impact of Amazon Prime on the wiring of a consumer's brain for health. And it really has implications for who is this patient today. And that's also all of you. I'm assuming we've probably got 60 or 70% of you who are Amazon Prime members. So when we get there, I'll ask you to raise your hand if you feel like it. And I don't think that's kind of HIPAA information. So if you'd share it, I would love it. And finally, what does this all mean for you all? So this patient, this person, this consumer, when you are with them, they're patients, but they go home, they're with you N minutes a year, and they go home and they work in their communities, they work outside the home, they have financial pressures. We are in an era of political stress. That's a real thing. I've been observing it since before the 2016 presidential election, where a few weeks before that election, the American Psychological Association did their annual Stress in America study and found then, a couple weeks before November 6, 2016, 52% of Americans were losing sleep over politics. And we know what losing sleep does to health, to eating, to any number of things. So I take that kind of data really seriously in my world. And finally, the patient has become the payer. And when we used to think about a payer in healthcare, we thought about the insurance company, the employer, the union, the government agency, the health plan sponsor. But now that we live in a world of growing deductibles, growing out-of-pocket costs, consumers paying first dollar to meet a deductible, I think it's important to think about the patient as the payer. And what does that mean when one is managing a household budget? Food, mortgage, etc. So this is welcome to my world and why I think digital health technologies are really important for this consumer, patient, caregiver, payer. So here is the evolution, and you all studied science, so Darwin was part of your learning. But increasingly, we people, humans, globally, are using multiple platforms for seeking information, for engaging with information. We're using multiple channels. So if you work in retail in a pharmacy, or with Amazon, or with Nordstrom or Wegmans, they talk about an omni-channel environment where consumers, people, are going to lots of places to access and consume information. And this is true for health information as well. A hospital with a portal has to be mobile friendly, PC friendly, laptop friendly. And if you work with your health IT folks in your offices or institutions, you know that's true. You must be mobile, but you also must be on a PC. So what's important about this is that consumer is in a lot of places, that patient's in a lot of places, and you have to think about their workflow. You have your workflow, and people, consumers, have their life flows and workflows as well. So just some data on tech in people's lives, because this is really important. This is where you all need to be if you want to drive behavior change. The average household has at least 5 connected devices, a couple of phones, a computer. If you've bought a television in the last year or two, or if you're going to buy one for the holidays in a couple of weeks, it's going to be connected to the internet. It's just how it is. Bluetooth, everything. So washing machines are increasingly connected to the internet to help you manage energy, presumably. They also want your data on whether you're using Tide or Kirkland's Costco brand, speaking of Costco. Anyway, this is the life of an average American, this is American data, consumer person now, and increasingly there's our TVs that are connected, but wearables, I'm sure many of you are wearing something. I've got a few things on, a couple you can't see, but I test out a lot of these devices. Look at the fourth element here, because this is growing really fast, and that's Amazon's Echo Alexa. Google Home, Samsung has a digital home assistant, digital voice assistant. These are growing in healthcare very quickly, and I'll talk about an example for type 2 diabetes in a minute. But I go to HIMSS every year, the Health IT Conference. It's the wonky place where your CIOs will go to buy new EHRs or any number of digital health tools for hospitals and clinics. In the last 2 years, the line outside of developers' booths who are developing Alexa skills for healthcare for both doctors and patients, they've been out the booth. You can't even get in. So this is a fast-growing area both for voice recognition for doctors and for patients at home. And I'll talk more about it, all the way through to virtual reality. At USC is Leslie Saxon, who you might know, in the Body Computing Center. She's somebody I've done work with. Virtual reality for helping people manage pain. This is all real stuff now. A lot coming out of your university, by the way. So you guys are doing great. And even drones for delivering medications to rural areas in America. Walmart's experimenting with that. Amazon's experimenting with that. So new things in tech. But ultimately, want to come back to this person, this consumer, this patient, who's doing lots of things to project manage life every day. So to get here to the hotel yesterday, you might have used Waze or taken Uber from the airport, Mint.com if you manage finances. I've been buying shoes off of Zappos and returning them 3/4 of the time for years, as I know a lot of the ladies in the audience know what I'm talking about. And then Open Table, you all might have made some of you might have made a reservation for dinner last night via Open Table. This is to say, this is just mainstream, normal behavior for everyday people, the people that you come into contact with. And it's not just for millennials, but I've got data I'm about to show you that show older people, over 50, over 65, use this stuff too. So this proliferation of digital health tools, there are lots of them. It's astonishing. I'm going to organize this for you in a way that's easier to understand. But from a simple SMS text that can remind people to take medication several times a day or test sugar, all the way through to remote health monitoring with WellDoc, W-E-L-L-D-O-C, an FDA-approved remote health monitoring device for people managing type 2 diabetes, which is reimbursable by Medicare now. As soon as that happens, we see adoption of these devices. So you've got everything from the phone, simple text phone, not even a smartphone, all the way through to amazing Internet of Things devices at home, and everything in between. This this chart came from the IQVIA Institute. IQVIA used to be called Quintiles. You might remember that name, big in pharmacy. How do I want to put this? Figuring out pharmacy claims and what patients were filling at drugstores, basically. But they've come a long way. IQVIA now does reports on the evidence of digital health, and they're showing that for conditions like heart disease and diabetes, we're seeing a growing evidence base for some digital health tools. So we always want to look for the evidence and go there. This is my view on how I organize these functions of the devices. So I go to the Consumer Electronics Show, CES, in Vegas every January, and you think that's where I'm going to see sexy cars and big TVs, and I am seeing those for reasons that will become obvious in a minute. But a few years ago, the digital health real estate at CES started to grow like mad with Fitbit, Garmin, Nike, Misfit wearables, and Under Armour. And then this growth into other parts of CES, particularly tracking the home, Honeywell, Samsung in the home, Whirlpool, the growing Internet of Things for the refrigerator, which I will talk about in a minute. And finally, the connected car, which I'm going to talk about, as a third space for wellness. We can track food. My favorite phrase of your presentation, which is a new phrase to me, because I'm not in your world, is collective chow count, or cumulative chow. Yes, intake. Cumulative chow intake, which I do on my FitnessPal every day. Who knew? I'm doing cumulative chow intake for me. Tracking food, one of the most popular things for people to do, sometimes in the brain, which is not good, sometimes on an Excel spreadsheet, which is better, but better on an app that you can then marry to Fitbit, blah, blah, blah. Tracking weight, that's my scale. The Withings scale, I stand on it. It keeps me honest about BMI. However you feel about BMI helps me have my skinny belts. When I was in Europe for 3 weeks, this belt could not leave the hole that it was on when I got there. That's what I do when I travel. When I'm home, that's what I do. That goes to the cloud. I can track it. I can see BMI, stay within a range I want to. Activity, you all probably have bought something at least once, maybe thrown it in a drawer like 50% of people do within 3 months. In any case, I'll get to the real numbers of that in a minute. We're tracking sleep, we're tracking heart rate. This is a Versa Fitbit watch. It tracks my heart rate from the wrist. Omron will have an FDA-approved watch by Christmas, I am told. They want it out by Christmas. They're working closely with the FDA. Blood pressure from the wrist. Omron is a very popular brand with older people. Big numbers, simple technology. Buy it at the back of CVS and Walmart, or buy it for your grandparents or your parents. That's for heart function. Stress and mood, gait, we can measure. Leslie Saxon at USC does a lot of work on that. Anyway, I organize these categories in these 10 ways with what I see, how to track different things. Now, some numbers on uptake among consumers. This is one study from Rock Health. They're a digital health innovation lab in Northern California. They also invest in companies. I'm going to give you a range of data, not just Rock Health. This is their data, but I'm going to give you a low and a high. It's mainstream now for patients to go online and Google, page Dr. Google, put in a symptom, name of a new drug you're prescribed, but most American adults now go online to search health. That's just mainstream. Before a doctor's appointment, after a doctor's appointment. When you're prescribed a new drug, go on, seek side effects. Direct-to-consumer advertising also pushes people online to look at the fine print, and that's an FDA regulation when you do a DTC ad. Also, at least half of Americans go online to Yelp, to Healthgrades, to many places to look at provider reviews. This is the world now. People go to Amazon to look at a review for a product. They're looking for reviews of doctors. A lot of doctors don't like this. This is the world now. Some people go to Healthgrades, which is more statistically valid. Maybe some people just go to Yelp like they do for a restaurant. Then we see to the left the 3 categories of telehealth, video telemedicine, wearable tech, and mobile tracking. Basically, it's according to Rock Health in last year, which is the latest data they have, it's 1 in 5, 1 in 4 people taking advantage of telehealth, tracking via wearables, ongoing, not just buying and putting it away. And then, wearable technology and mobile tracking. A study that I wrote about yesterday in my blog on Health Populi from Oliver Wyman, their data shows more like 10 to 15%. Another survey from United Healthcare, which was a national survey, said 40% of people are doing these kinds of things, telehealth. I can say this with certainty, that employers in commercial insurance now, most large employers are paying for telehealth visits to sway people from going to the emergency room when they don't need to bend their cost curve. So we're going to see, since there is reimbursement now for the patient on that high deductible, to use a retail clinic or a video visit through Teladoc, American Well, Doctor on Demand. We will see quick uptake in the next couple of years, where we saw it fairly flat. Now that it's an employee benefit going forward, we're going to see more of that happening. Consumers like this idea. Older consumers, a little bit less than younger consumers, because of that relationship that they've struck with the health system. But we're noticing, and this is a heads up, if you're a young practitioner growing a practice, millennials do not value generally the concept of a primary care medical home, one doctor all the time. They want access, convenience, but a relationship with the physician may be something that millennials are not looking for. Perhaps once that person has children, they might. But when we look at single younger people, it's get in, get out. Skype with a doctor kind of thing. So this is this omni-channel idea where you want to respect the values of a patient and what they want. What patients do say, though, is that these new formats, retail clinics, telehealth, wearables, I see value in that for my health. And what's really important for the population now, we're going to start thinking more and more about people who are obese, overweight, and sicker, is that the sicker you are, the more you're likely to value these new formats, because we know we have more workflows in our day when we are managing diabetes or any chronic condition. So the more we have access to these tools, the more likely we want them, especially if they are well designed and fit into our lives. So that's what this chart from Deloitte points to. Now, here are various activities and treatment components in diabetes coming from a 2013 article in the Journal of Obesity. And I look to this and I say, well, lots of these things can be done via digital tools and websites. So here, from Rock Health's data that we looked at earlier, they asked people, what are your top reasons for wearable use? And the number one and two issues are to help me stay physically active and to lose weight. These are two things we need to have happen amongst people who are dealing and managing obesity and diabetes, and less so sleep and managed stress. Though sleep is top of mind for lots and lots of people today. Now, if you look at the top line has to do with people with heart disease. Look at the bottom amongst people dealing with obesity. This is really important data for you. Rock Health asked people, are you tracking weight, food, and physical activity? And the bottom three data points are for people who say they are obese. So 2/3 of people who are obese said, I'm tracking my weight. What the other third are doing, I don't know. But 2/3 are tracking weight. Food and diet, though, and then 1/3, are using a digital app. That's what I want to point to. For food, 2/3 are using a digital app. And for physical activity, over 50% are using a digital app. So we can see there's already a tipping point for people who are obese using digital tools. Whether you're prescribing them or not, this is what people are doing. And I want to get to you're prescribing them in a minute. So now looking at managing diabetes and obesity, so we're getting more granular now on some specific technologies that can be used. And these are just examples. I'm not recommending these or not. None of these is a client of mine, but this is one useful chart that shows a sort of complement, a constellation of technologies that can be used, from insulin pumps all the way down to social networking down in the bottom right. Has anybody heard of Patients Like Me? So Patients Like Me was started about 12 years ago by two brothers living in Cambridge. Well, one was living in Cambridge, Mass. The other moved home from LA to Cambridge. The Haywood brothers, H-E-Y-W-O-O-D. And their youngest brother was diagnosed with ALS, Lou Gehrig's disease. And the two older brothers got together. One was kind of a movie producer in Hollywood type, creative type, and the other was a quant head in Cambridge out of MIT. They started Patients Like Me to help their younger brother dealing with ALS gather data on the drugs he was on, his physical erosion, what was going on in his patient journey. And today there are over 150,000 patients sharing intimate details on their care, their patient journeys, in every disease category, condition you can imagine. I use their data a lot to mine for particular conditions and do research, like small sort of focus groups with patients, and that's part of their business model. But I'm here to say peer-to-peer healthcare. Social networking is very, very powerful, can be for some patients who want that kind of support. I've seen patients in that community and others. One might be in LA, one might be in Zurich, compare notes and suggest, oh, why don't you ask your doctor to up your dose on X drug because it's working for me with ALS or Parkinson's or HIV or fill in the blank. So I want to especially point to peer-to-peer care, social networking, because you might not think about it when we think about wearables or telehealth or retail health, but it's peer-to-peer networking can be very powerful. We're seeing this in the Veterans Administration with PTSD and depression, veteran-to-veteran counseling support coupled with other meds and technologies can be very powerful. So anyway, this is just to say there's a lot available in the area of obesity, overweight, and diabetes. Now, thinking about this consumer mindset, I want to talk for just a couple of minutes on why I think you should think about Amazon and the impact on the person, on the consumer, the caregiver. So the Harris poll, who you've all heard of, asks U.S. adults every year, what brands do you buy, patronize, work with that you feel respect you? Who has high, quote, brand equity? And Amazon earlier this year came out as the top. You see lots of grocery stores on this list, some autos, some financial services, fast food to the point of geography and food. But Amazon, number one. And so So one of my favorite New Yorker cartoons, HAMLET versus Amazon Prime, he says he needs to buy something. That is the question, but it's nobler to buy locally. And all of you remember the days when we'd go to our local bookstore to buy a book, and we have, most of us, I think, shifted to Amazon and especially Prime. And then HAMLET has to deal with the existential question, but the free shipping, which gets everybody, and it gets HAMLET clearly. What's interesting about Amazon Prime, particularly for health, is that earlier this year, they started to discount Prime membership to just under $6 for people enrolled in Medicaid and on SNAP benefits. Now, can you imagine someone living in a food desert or someone who can't get out of the house who could order a nice, fresh grocery basket of some green things, some fresh things, some frozen stuff, delivered via Prime? The question I've asked some folks there is, did you do research to see if a person who's enrolled in Medicaid or in SNAP can afford $5.99 a month? Now, I ask that question, but in a value-based environment of payment, it may be that if you can get around Stark laws, and I have asked lawyers about this, and it can be done, you can actually bundle this into a prescription. And I'm going to show you how this can be done. So here is a startup called Zelf, like health, but starting with an X. And Zelf's two big investors are UPMC in the western part of our state, University of Pittsburgh Medical Center, which does a lot of digital health innovation, and Providence Health System in Seattle, which is the home of Amazon. So the two big investors in Zelf are UPMC and Providence, and they work with Zelf, and Zelf is a digital platform which helps doctors, health coaches, physical therapists prescribe, little p. You can prescribe a drug if you're a doctor, but in the same prescription on the Zelf platform, you can prescribe a piece of wearable technology, you could prescribe broccoli, you could prescribe anything you could buy in the Amazon store. And then all of this comes on one list, and when you prescribe it, it goes on a list in Amazon, and the patient can click, send it to me. How that gets paid for has to be sorted out. The patient might get reimbursed. The clinic might pay up front, depending if you're taking on a value-based payment, or if you're Kaiser or Providence Health System or UPMC and have an arrangement. In any case, we now have the technology, not just on individual wearables and prescriptions and medication adherence, but these platforms allow us to do many things in one place place to streamline the patient's life so that we can ensure greater probability of adhering to all these different things when it's in one place on one list. So that's the promise of Zelf. This is a new thing. It's important. We think about Amazon Now and Alexa specifically. Alexa's not the only digital assistant, but it's a popular one. And there are many Alexa skills now designed for health. And when I say skill, if you haven't worked with an Alexa, when you call out, "Alexa, will you?" Alexa will respond if she knows what you want. And there are many tools, applications you can put on Alexa now that are developed for health. Medication adherence tools, tools for people aging at home to remind them of memories. It could be someone dealing with dementia, and when they hear Willie Nelson music, they get happy. So Willie Nelson will play with a particular particular ask of Alexa. Anyway, this is very promising, and we're seeing Alexa skills happening, especially for medication adherence, which is interesting. So you ask people managing health issues or not, do you see voice technology, an Alexa type thing, helping you? And most people say, yeah, I get the idea of a smart digital device helping me for, say, medication alerts. 57% of seniors said, that sounds like it could work. And that doesn't mean they're going to adopt it, but we have the initial feel that this could be something we should test out, certainly. Amazon also has, of course, Whole Foods. Whole Foods can be used for not just food, but if you know, Whole Foods have these Amazon lockers in them now where you can order things from Amazon and pick them up. Increasingly, they could use those lockers or the bricks and mortar stores for more health stuff like retail clinics in real time. Because Amazon bought, let me shift to the next slide first, PillPack. I was watching, MSNBC before I came down, and there was a PillPack ad at 5:30 in the morning. PillPack is the service that allows you as a consumer to put on a list of your medications, get your prescription shifted over there, and PillPack organizes the new age of the little Sunday to Saturday plastic box of what to take when, but PillPack has these labeled drug by drug, time of day by time of day, sends this to you every week or every month, depending how many prescriptions that you have. Amazon bought this company for $1 billion, and it sounds like, okay, Amazon's in this PillPack business now. But what's underneath that is that Amazon now has licenses in 50 states to be in the pharmacy distribution business. That's the point. This is cool. This is good for grandma, for people managing multiple conditions. But Amazon now can work in Hawaii and Alaska and Nebraska and Minnesota and Massachusetts if it chooses to do something in bricks and mortar pharmacy where it's got lots of stores and be in this medication adherence PBM type world. We could talk about PBMs, pharmacy benefits management, all morning. We're not going to because it's a political hot topic right now, and I honestly don't know where it's going to go in the next year after Tuesday or 2 years from now. So I have to wait on that. So I'm organizing this. Okay, I've got a couple more minutes. Examples of on a continuum of physical tools and digital tools that are remote, virtual, and how might this play into a person's life managing overweight or obesity and diabetes? So these are just examples, but it's kind of a flow. So it's a little story. So she or he, well, she's probably getting a pink Fitbit. So you start with the zip, and I've had all these, by the way, because I'm just obsessed, and it's what I do. Anyway, there's the verse I'm wearing now. But I did this article a month ago on, pink for breast cancer and Fitbit. Anyway, the patient could get a tracker. Now, in the case of Fitbit, they acquired a company called Twine Health, which does health coaching, particularly in the area of type 2 diabetes. So now you can start to marry your Fitbit data to your blood glucose data, because not only does Fitbit align with Twine, and what's important is they did the hard work of coding the data to go from different devices to the Fitbit cloud to integrate it for the consumer. So you, as a consumer, don't have to keep that Excel spreadsheet every day and put the data there. Through the magic of things called APIs, application programming interfaces, data standards, open standards, data can now go where it needs to go, to one place. And, so from Twine, Fitbit also works with OneDrop on digital glucometer services, so that when a patient measures blood sugar, that data can now go into the Fitbit cloud ecosystem. And OneDrop is working with Alexa, so the patient can say to Alexa, remind me what my sugar was 2 hours ago, or whatever you told me. Or call up OneDrop, let me see a screen on my watch. And we move then from that world, Alexa in the connected car. I told you I'd talk about cars. I grew up in Detroit, so I got to talk about cars. You go to the Consumer Electronics Show now, the third year this year, they started to talk about health and wellness bundled in the car. First it was Mercedes, it was the German manufacturers, high-end Audi, Honda and Toyota from Japan, on different paradigms. In the German cars, it was more about wellness, and BMW had a breathalyzer in the car. You couldn't start the car if you were drunk. That actually is a really great thing for public health, I would argue, but anyway. Now, though, this is becoming more mainstream in prototyping. Toyota, a few years ago, had the prototype where the car was driving in an urban area. The air quality was perceived outside to be very bad for the driver with asthma or COPD. The windows were open, so the car automatically shut the windows and turned the air conditioning on and the filters, so the person's asthma or COPD wasn't exacerbated. These functions are now getting more and more tested, streamlined, and now we have the Internet of Cars for health. Within 5 years, we'll be seeing this stuff come out. This is just to say you start with a wearable device, you move through this ecosystem of digital health, and increasingly these platforms are helping patients and doctors and coaches integrate data where people live, work, and play. Not in your office. Has to be, particularly for obesity, diabetes, heart, lifestyle-borne diseases, which are 80% of what we spend our money on in America. The stuff that we can prevent. So we go back to the patient and the doctor says, here's a stress test. We take your blood, we send it to the lab, and you never get your results back. That is how the average American patient feels right now. The system does not work for me. Amazon Prime works for me. I order something, I have transparency, there's lots of choice, there's reviews, and I get the thing in a day or two. So, consumers we know, even older consumers, are open to the idea of these digital health tools. They are on board increasingly. But the health system, us, is not seen as a very user-friendly vehicle for wellness and health. Healthcare, when we need healthcare, of course, we've got to go to the hospital, got to see a doctor. But how can you help me manage my well-being better? So in this study, look on the right at the list, consumers were asked, what industries do you feel respect you? So household and beauty and personal care and entertainment and technology. But you go down and you see healthcare and pharma in the middle to the low area, and healthcare insurance sucks, pardon me. People say healthcare insurance is as bad as the government or telecoms, Verizon, Comcast, name it. So healthcare ranks pretty low on experience. Now, this is the most important piece of data in the doctor's world. Here, we're going to give you a statistic that's really important. In a study funded by Robert Wood Johnson and conducted by the Alterum Institute at my alma mater at the University of Michigan, patients managing diabetes were asked after leaving the exam room with the doctor, did you feel like you were respected in the encounter with the doctor? The doctor was telling you about a medication to take and blood glucose testing. And for patients who felt respected, they had a better outcome in terms of medication adherence and blood glucose management. So that moment of truth of feeling like I'm in the room with the doctor, learning, we're sharing decisions, I feel respect, has a hard return on investment. And that's really, really important, particularly as you're taking on more value-based payment as providers, and you want to achieve outcomes with your patients. This article from JAMA, Journal of the American Medical Association, is, I can't believe it, 3 years old now. I'm looking at the date, from October 2015. This is one of the most important things I've ever read in JAMA, and it's titled, Value-Based Payments Require Valuing What Matters to Patients. So this whole kumbaya I talked about at the beginning of the triple aim, the quadruple aim, engaging patients, activating patients so they do better in terms of outcomes, you got to think about that patient life flow, the patient goals, in all of that. And when the previous speaker was talking about the higher level of where to eat, how to eat, with whom to eat, these are social determinants of health. Where I eat, eating with your family, cooking with your family, you eat healthier when you eat at table with people, the Italian way. So that's in my brain. Consumers look to technology companies, at least half of consumers think technology companies can make life better. And in the eyes of the consumer, that's Apple, that's Google, that's Microsoft, that's Samsung, that's Amazon, as partners in health. So we've got this whole ecosystem now of you, face-to-face care, virtual care, and everything in between. And the consumer is omni-channel, is in all these places. So it's complicated, but it's not impossible, because working with these platforms that can bring data together, your best friends now are going to be health IT people who can help you corral data and design. The designers are really important, so that these designs of the technology are enchanting and easy to use, so people don't throw the Fitbit back in the drawer after a month. So this is what I leave you with. I showed you about the ROI on respect of the patient, valuing what matters to the patient. People living these omni-channel lives, they're in many places. You have to be in a lot of places too. You will work with partners in your communities, grocery stores, banks on financial wellness. So you think about, what is the new health fair? Walmart does health fairs all the time. Work with your local Walmart. But beyond the typical health fair, it's also, how are you paying for your medicines? Can we help you figure out a coupon program for the medicines? Can we set you up in the Walmart technology aisle? Again, Walmart not a client, just using it as an example. But Walmart's where a lot of people who are pretty sick and who don't have a lot of money go. They have clinics, they have vision clinics, some of them have dental arms, and Walmart just announced in the last 2 weeks they're going to create these healthy sort of community strips of real estate where there's not just a Walmart but other sort of health mall aspects. So watch for that in your community and participate where people live and shop. And finally, this issue of design is really important. So if you're going to start to prescribe and share recommendations on digital tools, kick the tires on them. Share a few of these with your patients. Get feedback, right? Do your own market research. If you work with a hospital, have the hospital get involved, or the health system. If you work with an insurance company, more and more are keen to drive adherence and will work with you on this. United has its own device, activity device, that it's marketing internally to folks. And finally, this issue of my fiscal health, the patient is the payer, married to my physical health. We know at least 50% of Americans have self-rationed something for their health care, a visit to the doctor, a drug prescribed in the last year due to cost. That's among people who are both insured and uninsured. So value and values, really important. So I've stuck to my time. And if you have questions, maybe we have time for a question or two. I tweet as Healthy Thinker. I tweeted this morning about you all. Happy to be here. And there's my blog at Health Populi. So if you have questions going forward, and I think these are printed in your books. So in 2 months, if you have a question, email me, and I will get back to you. So thank you so much.
This has been a Dana Miller Video Network presentation.